How is the ABI test performed? Have you ever wondered how healthcare providers check for issues with blood flow in your legs? One common method is the Ankle-Brachial Index test. This simple and non-invasive procedure is especially important for those with hypertension. Let's break down how this test is performed step by step. First, the patient will lie flat on their back for about 10 minutes. This resting period is essential for getting accurate blood pressure readings. During this time, the healthcare provider prepares to measure blood pressure in both the arms and the ankles. Next, a standard blood pressure cuff is placed around the upper arm and another cuff is positioned around the lower leg, just above the ankle. Both arms and both ankles are checked to ensure a comprehensive assessment. Now comes the interesting part. The healthcare provider uses a handheld device called a Doppler ultrasound. This device helps listen to the blood flow in specific arteries. For the arms, the cuff is inflated and then slowly deflated. The provider listens for the return of the pulse in the brachial artery. This process is repeated for the ankles, focusing on the dorsalis pedis and posterior tibial arteries. After listening to the pulses, the systolic blood pressure, which is the top number in a blood pressure reading, is recorded for each artery. To calculate the Ankle-Brachial Index, the higher ankle pressure for each leg is divided by the higher of the two arm pressures. This calculation gives a ratio that helps determine if there is reduced blood flow to the legs. Normal Ankle-Brachial Index values typically range from 1.0 to 1.4. If the values are lower, it may indicate peripheral artery disease. This condition is where narrowed arteries reduce blood flow to the limbs, which can be particularly concerning for individuals with hypertension. The entire test usually takes about 10 to 20 minutes. There are no needles or incisions involved, making it a comfortable experience. Patients can return to their normal activities right after the test. For those with hypertension, the Ankle-Brachial Index test is an important part of routine screening. It helps identify early signs of vascular disease, allowing for timely management. Knowing how the test is performed can help patients feel more at ease during their visit.